and I'm one of the pediatric trainees from UK, and I'm currently working at Colchester Hospital, and in 2021 we decided to perform this study to see how COVID affects the life of babies being discharged from the neonatal unit. So from the background, the WHO recommends exclusive breastfeeding for 6 months after infant is born, and in UK, we highly recommended breastfeeding at discharge and during the attendance in neonatal unit, and this also highly monitoring, and we have several audits running nationwide just to see how the breastfeeding going in during the admission and unit and after discharge. And we all aware that breastfeeding is protecting babies and mothers from a different range of disease. The breastfeeding protects babies from the developing sepsis, NAC, and also further in life, we can see the children who receive breastfeeding, they actually develop better than children who had lack of breast milk. And mothers, they protected when they breastfeeding. Emotionally, they actually doing much better, and they've got better link with their children. So, however, all the time, despite COVID or pre-COVID or after COVID period, I believe mothers face different barriers, and this is why breastfeeding sometimes difficult. And from these barriers, I would like to mention social cultural issues, medical, and also prenatal issues. And we know that preterm infants have few nutritional reserve at birth and them term infant. And our aim for the babies who are born premature to deliver breast feeding initially with express breast milk and encourage mom to express. And some unit in UK, and I'm sure worldwide, use donor milk as well to help babies and protect them. So unfortunately, we all been in COVID-19 pandemic, and in UK, the restriction came on 16th of March 2020, and the life definitely changed during the lockdown, and so many hospitals, they apply quite strict visiting policy, and only one parents was allowed to come to see child in neonatal unit. So it was a problem with transport, and people been allowed to come outside only for 1 hour per day. The families were basically separated. They didn't see each other, and we believe the mothers in that time didn't have great support. And also in UK, we've got breastfeeding cafes where actually provide great help for mothers who breastfeeding, and they meet other mothers and discuss the breastfeeding pre-COVID period. So, but unfortunately, in that time, during the COVID pandemic, these centers were closed. So I and my colleagues came to conclusion that we need to see how the COVID-19 restriction affect breastfeeding in neonatal unit, and this is came to our mind in 2020. Just when the restrictions were released. And this was a retrospective study, and we used different system. So in my hospital, we use Evolve, it's a local health care system, and we use budgets, national electronic system, where all children who admitted to neonatal unit registered, and it's quite useful and the system. So during our study, we wanted to see actually how the mothers doing with breastfeeding, and we look at the first day when the breastfeeding was introduced, or EBM was introduced, and also to see how many went home on breastfeeding or mixed feeding. So we wanted to see kids actually receive breast milk during this neonatal unit. My unit were working at the moment. It's level 2 neonatal unit, and all children admitted there. Majority children admitted there. They are from 28 week gestation. However, we got different children, and sometimes with 22, 23 weeks gestation children, and also term children who admitted with sepsis, hypoglycemia, so different variety of children. So in our study, we had two periods. The first period between March 2019 and December 2019. So prior the COVID, and period 2 is between March 2020 and December 2020, when the COVID lockdown restriction was, and when the restriction policy was applied to the hospital admission. So you can see during the period 1 and period 2, we had different gestational age children. From the period 1 from 25 weeks, and in period 2 from 28 weeks. So in level 2, we tend to transfer children before 28 weeks if they require prolonged gestation. But if these children 25, 26 weeks, they've been transferred to the tertiary center. But however, our aim was to give them the mouse care of 24 hours. So in our study, we had during the period 1, 535 kids, and during the period 2, 380 babies admitted to neonatal unit. And you probably noticed this is, was slightly quiet period for the neonatal unit compared to pre-COVID. So we could see the babies who receive milk on day 1, in period 1, for them period 2, and also we noted that the babies who been discharged home from the neonatal unit in period 1 receive more breastfeeding than kids in period 2. So, and our conclusion were that from our data analysis that COVID-19 lockdown affects children who maybe require breast feeding, but because the lockdown they didn't receive this breastfeeding. So you can see in period 1 we had 63.5% kids receive breast milk, and only 8 kids receive milk in period 2. This is was for children who've been mixed fed, so they had some formula, and also the exclusively breastfeeding including this percent. So we know this is a retrospective study, and we only look at 2 periods, only 10 months. And we are aware that during pre-COVID period, we offer support to women, and there was different length of stay for the kids in both periods, and we also didn't look at other factors, and which could affect the breast feeding. And we don't know actually how many mothers wanted to have breastfeeding in both periods. However, we always explain to all mothers who children were admitted to neonatal unit that breastfeeding is important for kids, and we also encourage in both periods to express milk. So we believe there are factors which significantly affect breast feeding during the pandemic, and such as lack of support of skilled workers who can explain mom the breastfeeding importance, but also to show how to breastfeed the child, to help them to understand the importance of breastfeeding, and lack of communication as face-to-face communication during the lockdown significantly reduced. And also we believe the new mothers children were admitted to the unit, they didn't have great support from the families, because there only one person is the bedside. It's difficult. Their fathers couldn't support mothers, but also family couldn't see this newborn baby and understand how small they are and how important express milk. And we believe that some mothers, they try to have time with baby, them to go to express, and also the worries about transmitted COVID to your child there. So mothers probably didn't want to have expressing milk when they had COVID-19, or also been reluctant to travel to hospital because they've been worried to cut them COVID. And we believe the reduced opportunity to have skin to skin also could affect the breastfeeding during the lockdown. So after the study, we developed some recommendation for the unit and for the midwifery team in case if we would face other disruption, or if it would be other COVID lockdown measurement apply for the visiting policy. So we find that support the mother to take informed decision about feeding is very important, and provide some literature, and there are several applications when the mom she can have more information about breastfeeding. So we also believe the skilled workers can help mothers with the first hours of breastfeeding, to especially for the mom with baby in neonatal unit, and mom who never breastfed, so positional baby, how to do skin to skin contact with baby, and also to organize some meeting with mothers and midwifery team or the nursing team, would definitely to help to understand the importance of breastfeeding and share their stories. It's also important. It would boost confidentiality for the mothers who is planning breastfeeding. So our recommendation that we need to provide more support and provide some room for breastfeeding, and provide the milk to initiate milk supply with providing more pumps, and explain to mom how often to do expressing. And also we believe that very important to develop adequate training for staff, to develop skilled breastfeeding support team, organize breastfeeding counseling session for mothers, and also for whole families to explain them how breastfeeding during the natal unit stay. And we at the moment try to establish actually the connection between this breastfeeding cafes in our town and nursing and midwifery staff, would help to explain the cafe staff how to support mothers, and organize more session, and have meetings. So at the moment we going through second study to see actually how our recommendation working in our unit, and what else we can do to help mothers and their babies to receive breast thank you very much for your listening, and any questions?
Thank you, Doctor, for that excellent presentation. We hope the participants have learned a lot. Are there questions?